pessoal, tô aqui me preparando para uma aula que eu vou dar no Texas Institute of Dermatology para o staff de dermatologia. E, bom, basicamente são as minhas perspectivas, qual a minha forma de analisar a pele em envelhecimento e como eu conduzo os meus tratamentos. Então, vamos lá? Revisar?
In 2 miles.
Good afternoon. I'm here to present my perspective on how I analyze and treat the patient in the aging process. Well, first of all, we need to keep in mind the key aspects of the aging process. Loss of volume resulting in ptosis due to reabsorption of collagen and fat. Dyschromic lesions and skin tumors also come into play, and they need to be individually treated. Well, what's really interesting about the aging process is that each decade gets really well demarcated with its very own characteristics. So what we're going to see in the mid-20s, for instance, is going to see basically dynamic wrinkles, right? These dynamic wrinkles can be easily treated with botulinum toxin, which is Botox. On the other hand, you should have your patient start a regimen of skincare products, a home care line, or individually prescribed products. And those will go along very well with peelings and lasers, especially fractional lasers, in a preventive fashion. Well, in the mid-30s, we're going to see not only dynamic wrinkles, but some lines around the face, especially on the lower third. And the most commonly seen will be the nasolabial folds, and they're easily treated with a very dense filler, which can be hyaluronic acid or hydroxyapatite, calcium hydroxyapatite. Also in the 30s, it's very important to recommend the patient that he comes regularly for these peelings and intradermal therapies, also CO2 and or erbium lasers, obviously fractional lasers, which can also combine with other light emitted technologies such as IPL or intense pulsed light, and other specific lasers for specific conditions. Okay, so what do we see around the 40s? Well, in this age scenario, it's very important to assess the patient globally in a way that we not only assess his face, but also neck, cleavage, and hands, because otherwise they will denounce the patient's age once he's treating, let's say, nothing but the face. Neck-wise, for this age and further, what I recommend is a combination of botulinum toxin with fillers in a volumization technique. It can either be hydroxyapatite, it can also be polylactic acid, and those combined with skin boosters in a very periodic fashion. Not to mention fractional lasers for these areas. These are very important. These are very important, both for the lines as for the skin texture and the skin tone as well, to control all that sunspots and all that. Well, and same for the cleavage area. For the hands, maybe it's not the time to start with lasers. It's very individual, but that's when patients start to think about that too, besides the fillers, which are specific for the hand. I like the calcium hydroxyapatite for hands. I think it just gives out a very natural look. Okay, so around the 40s, the loss of volume really comes into play, and it's going to be prominent around the temples, around the mouth, especially underneath the lower lip, also around the chin. Not everybody, but some people will see some reabsorption of volume around the lip and also chin on this age. Also going to see an important loss of volume around the mandible, compromising its contour, and it's very important to offer these patients treatment for these areas. The patient needs structure, right? So we need to use fillers, not only for filling and lifting, like the malar region and the chin areas, but also for projecting them and restructuring them. So we need to restructure all these areas. We need to use both bolus and fanning techniques with fillers to help form pillars here in a way that you lift up the depressed smile. What else can we do? Around this age, some people claim that they already have double chin, which can be treated with the oxalic acid combined with buflometil and other substances that will reduce edema. Those can also be complemented with the use of microfocused ultrasound. It's a very special type of laser that will act in the muscle, producing microcoagulations, and this will end up making the muscle contract and hypercontract and successively in a way that will start contracting bands and just making the whole lifting effect, which can be used not only here but on the face, around the eyes, in even chest and cleavage and neck. Well, I not only use and recommend this laser for patients around this age and above, but what I do is I recommend a whole setting of treatments combined together. Many patients get frustrated with not only how long it takes to achieve certain results on treatment. I find to offer the most results in one session or in less time, it's just combining treatments together. And I offer this type of combined series of lasers, which can be done in the very same day, which are the intraoral laser that works around this area, preventing and also treating all the little wrinkles around the mouth, and also giving a little bit of volume and enhancing the circulation around it. And I offer microfocused ultrasound that will be the laser that acts deepest in the skin, or rather it acts in the muscle, so that's the deepest we get with laser emitted technologies. And besides that, I also add up to the combo the microneedling radio frequency, and along with it either the CO2 or the erbium, but obviously the fractional type, that will obviously reduce a little bit of the downtime for the patient, although these lasers together will obviously be a little aggressive. But aggressive treatments result in better results, right? Well, this is a combo that I offer my patients, but it's not isolated. It can be done once a year. It doesn't mean that they have to do all of them. If they rather do just 3 sessions of fractional CO2 or fractional erbium a year, that's fine. If they want to do 1 session of microfocused ultrasound, that's fine. I mean, we just have to look at it in a very individualized way. Now, let's go to the mid-50s. In the mid-50s, what we see is a very dramatic loss of volume, right? With important ptosis all around the face, around the eyes, sometimes a blepharoplasty is indicated, and also other mini surgeries. Well, the key here is to think of strategies that will do lifting Okay, so we have the non-surgical and the surgical techniques for lifting this face up. We can start with the 8-point lift and other techniques, MD codes, GAP, and many others that will bring back the volume, restore the volume to the very specific areas of the face, and also remodel and mold the whole bone structure in order to restore the three-dimensionality of the face. So among the non-surgical options, we've got threads that will do lifting, and obviously one is not going to be enough, so normally you're going to need many threads going from here and here. There are also threads and filler techniques for the nose, which we call non-surgical rhinoplasty, and they're recommended for pretty much most ages. We also have to consider some mini surgery, so blepharoplasty and other mini liftings can be done and or combined with lasers in a more aggressive way. We also have a very deep peeling that offers great results in the very all aspects of aging. It's called phenol, and basically it does a very, very aggressive type of skin rejuvenation. It really works, but it's risky, so it only should be done in a surgical setting. Not every patient is ready for that. Some of them would just rather do plastic surgery, but if well conducted, is a very, very good form of treatment. These patients from the mid 40s to mid 50s, they need to be approached about intimate rejuvenation. And why? Because by the time you start producing a considerable ptosis around this area, you might also be suffering with, you might also be presenting with ptosis in the vulvar region. You know, there's also laxity of the vaginal wall. There's loss of lubrication and other symptoms of intimate aging, which can easily be treated with some sessions of fractional laser and with excellent results. And the level of satisfaction of these patients is really amazing. I love performing this kind of treatment all together in a good combo with regular visits, regular consultations, so we can reassess this patient, look at what he's claiming, and conduct this treatment in a very individualized way. What are the key points here? The key points are have a macro vision, always analyze your patient in a very global fashion, combine treatments for better results, lower your patient's expectations and allow them to be prepared for the progress of results, and it takes time. Always give support to your patient. Be there, assist him, especially after each procedure. Make sure you explain to your patient each and every treatment and let them know the risks, the downside, the good and the bad about each and every service you offer. And you know what? If you do it this way, you're definitely going to be a very successful doctor.